Hi everyone, my name's Gillian. I'm the Regional Sales Manager from Shop Beautiful and I cover the North Eastern Scotland. Today I'm here with Dr. Helen.
Hello.
And Rachel.
Hi.
And I've travelled to the Aesthetic Treatment Room to discuss everything ARES. So if you're not familiar with ARES collection, now's the time to watch and learn more as I ask Dr. Helen and Rachel some questions.
We're so pleased to have you here as well, Gillian. Thanks so much for coming in. We love this product. We've been using their range for about a year now, so we're pleased to be able to talk about it, but don't make the questions too hard for us either.
I promise.
So we are doing a webinar at the end of this month on this product, so we'll be going into a lot of detail on that then. So if you haven't already seen it or you've missed it, then you can watch it on YouTube.
Perfect, thank you. So nice easy question to start with. Rachel, if you don't mind starting. Could you just tell us a little bit about the ARES collection?
Yes, so ARES actually stands for Advanced Regenerative Aesthetic Solutions.
Yay, she's been struggling with that.
So this is basically, it comes in 4 different solutions. They are pre-mixed cocktails of mesotherapy solutions.
Okay.
So they will help with different things. Helen's going to go into that hopefully a little bit later. When you ask her, please ask her the harder questions. It comes in a box. In each box you've got 4 vials of 4 mils of solution. You're probably going to use about 2 mils per typical face treatment.
Okay.
So you can keep what's left over in the fridge. So you're probably going to get 2 treatments out of each vial. So it is quite good from there.
Excellent, okay, thank you. And how would you use these products in your clinic?
So we typically use this with our 1 lead microneedling pen.
Okay.
It is something that is very good, but you want to introduce it into the skin. Now, because it's got larger particles in the ingredients, it's not going to pass through the protective layer of the skin.
Okay.
So by using a microneedling device, you're going to create micro channels so that it can be pushed into the skin and absorbed more easily. We also use it with electroporation. So this is basically no needle mesotherapy. This uses electrical currents and it just separates the skin cells so that the mesotherapy solution can pass through more easily. Some products can be used injectable, however it needs to be CE marked, and it's not currently CE marked, but they are going through the process for CE marking.
Okay.
Our insurance won't allow us to use non-CE marked, so we always use it with either electroporation or microneedling, but we've had some amazing results from this product.
Great. Okay, thank you. And how would you say this product stands out in comparison to other microneedling products?
So this is used by it's produced by CMED in Italy, and they always make their products to pharmaceutical standards.
Okay.
Now this means that the ingredients that they use are not always going to be the best ingredients, and you are going to get safe and effective results from the products that they make.
I think for us it's always patient safety is paramount. That's
Definitely.
what's at the forefront of our mind all the time. And to make sure that we're working with companies who we know they do everything to such a high standard and the rules and regulations
Absolutely.
are followed and things to make sure that the risk of complications is as low as possible for our patients.
Yeah. Another thing is, because it is provided by reputable suppliers, so it is provided by Shop Beautiful and MedFX, who are reputable, you know that they're going to be good standard products, whereas there's a lot of places that
May not be.
Okay, that's great. Thanks so much, Rachel. So moving on to yourself, Helen.
Give me the easy questions. I don't want
These
the
are the
hard
easy
ones.
questions.
Okay,
You did
good.
ask for them, so I'll give you that ones.
That's so nice.
So you did mention there was 4 different products in the collection. So how would you know which one to use
So
and what for?
they're fairly easily identifiable. They're colour coded and they've got different initials on it. So we've got AA, which is blue. That is for anti-aging. So it's really suitable for older, wrinkled skin that's sort of lost a bit of moisture, a bit of luminosity as well. Then we've got AK, which is green, and that product is really good for, it's a dermal restructurant, so it's really good for skin turnover. So any issues where the skin's a bit dysfunctional, so it can be used for like rosacea, maybe eczema, psoriasis, so for us, as long as there's no active disease at the time. We've got no open wounds. We've got then the AO, which is good for giving skin luminosity. It helps with dull, tired looking skin, but also helps with pigmentation. And then we've got HB, which is exactly what it says on the tin, so it's the hair booster. And that's going to help to prevent hair loss. It's going to help to strengthen remaining hair, and if there's follicles still present, it's actually going to help to stimulate those back into action as well.
Great, amazing. I think it does make it a lot easier as well when it's colour coded.
Oh yeah, definitely.
So
And it
really
makes them
helpful.
easily identifiable.
Yeah, absolutely, yeah. Is there any time when you wouldn't use these products on your customers?
Yeah, so we've got our usual list of contraindications. You've got your pregnancy and your breastfeeding. You know, it would be unethical to test on this group of patients, so we always avoid it.
Yeah.
Autoimmune diseases, diabetes, their healing is impaired, so we're not going to do anything which is going to damage their skin to sort of compromise that. Then we've got any active skin infections, any herpes outbreaks, if they've got cold sores, avoiding treatment until that's over as well. But then again, with the hair booster, it's a situation where if their scalp is pink and shiny, there's no hair follicles there. It's not going to magic hair up out of nowhere. So if the hair is thinning, yes, it's going to help to thicken that hair and to keep the follicles there. But once it's gone, it's gone. There's not much you're going to do to regenerate that as well.
Okay, and what skin complaints would you use these products for?
Okay, so it's looking at, again, the ingredients in the products as to what's going to be suitable. So the AA has got different peptides in, which has a Botox-like effect on the skin. So again, with older skin, it's going to help to smooth it out, to make it look smoother, improve the tone. It's going to help with fine lines, and then it's got hyaluronic acid in, which is going to help with those deeper wrinkles as well, to plump everything out. The AK has got succinic acid in, which is a metabolic intermediate, which means that it's actually really important in a lot of metabolic processes for skin rejuvenation. So it means that putting that into dysfunctional skin helps to make it functional again, and helps it to process properly, which means that for people like rosacea sufferers, it's going to be really helpful to them. But you've got to be cautious with this and make sure that it's not for one, it's being diagnosed, but for two, that it's going to be on somewhere where the skin isn't too compromised, so we're not actually just causing damage that's not going to be able to repair itself. But because it's an anti-inflammatory, antibacterial product, that it means that it's actually quite good for people who suffer with acne breakouts. Again, as long as we're not having active acne, we can't microneedle through active acne, we'd just be spreading infection again. The AO has got safranal, curcumin and ferulic acid in it. The curcumin is actually a derivative of turmeric, which is got really strong anti-inflammatory properties. So again, it helps to reduce inflammation in the skin, but helps to improve luminosity. This is a really good product for any hyperpigmentation as well. So it helps to reduce that, as it inhibits melanogenesis, and it helps to promote angiogenesis. So that's what's going to help to give your skin that sort of luminous glow as well. And again, hair booster, like we've said, it's going to help with your hair. So male pattern baldness, female pattern baldness, and some forms of alopecia.
Okay, great, amazing, thanks. And can you use these products alongside a chemical peel?
So you can use them in combination with other products. You need to check with your insurance. So it's like everything. Rachel and I are very cautious, aren't we? We always make sure that we're covered for all of these different products. That you may be insured separately for these, but you may not be insured to perform them in combination. So it's just important to double check. You know, most insurers do, but just double check. So it can be performed after a chemical peel, so BioRepeal, which is our little hero product. We love it. You could do BioRepeal and then possibly use it afterwards. You could use an LED light for your LED mask after you've done it. You could use the Forever Prep to degrease and clean the skin, and then use the product. There's a few different things that you could use it in combination with. But not only that CMED has their aftercare, which is the BioRehydra and BioRelift, which you can also upsell for home care. Okay. So there are little bits that you can add on there as well to make it more profitable for you. Yeah.
Absolutely great. Okay, well, there you have it. 4 amazing products to be used, very versatile as well. So if you are interested in the ARES collection, you can purchase that from Shop Beautiful. And we do have a code for new customers, which is brand new, and that is all in capital letters. Thank you.
Thanks for watching.